Dr. Patrick Nuzzo. I'm the founder and president of Southwestern University of Naprapathic Medicine. Some of you may not know what naprapathic medicine is, but it started right alongside chiropractic more than 100 years ago, actually in 1906. The founders, Oakley Smith of naprapathic medicine and D.D. Palmer of chiropractic medicine, were together back then. So the philosophy and the education of naprapathic and chiropractic is almost identical. What differs is the way we treat and what we treat, okay? Naprapaths treat the connective tissue to bring bony alignment versus a high velocity adjustment to bring bony alignment. What I'd like to talk about today is foam rolling and using the ball on the spine. I really believe foam rolling is beneficial for the long muscles, the legs, the arms, the limbs. I think it's actually detrimental using it on the spine, okay? When people tell me that they use the foam roller to stretch the spine out, I will always show them that every one of these vertebrae in the back has 17 ligaments that attaches to the one above and the one below. And as you could see, the nerve exits out of what they call a foramen, out of each vertebra, both sides, and then there's a hole down the middle that's also a foramen. It's the large foramen. That's where the spinal column goes. Now you could see that these vertebrae are movable, okay? So when you bend and when you move, they should flex. These are called facet joints, and those facet joints should be able to move like this, right? So remember, all those ligaments are in there holding those bones to bone. Ligaments hold bone to bone. So when you lay on a foam roller, okay, what you're doing is pushing down on these spinous processes, pushing down and collapsing them on those vertebrae, on those soft tissues, and more importantly, on the nerves in the foramen. So it probably feels good to roll on the foam roller on the spine, but it's really a much better idea to roll on a ball. And I want to show you why. As we come over here, I always tell people this is a 55 centimeter ball. It's kind of a standard ball. Depending upon your size, you want to go either up 65, 75, or they make them as 35, 45 as well. But I always tell people, sit on the ball, put it in a doorway, sit on the ball, hold onto the door jamb, and then just let your feet come out forward and then drop your head. Okay, as the spine, and I'll show you in a little while the vertebrae over the ball, but as you're rolling on the ball, those facets have an opportunity to do their normal movement, and you're not pushing and putting pressure on the spinous processes to irritate or affect those ligaments and the foramen. So it's always good to spend a couple of minutes in the morning. I always tell people, especially people who are on a computer all day long, which everybody is, they're sitting there like this all day long. This does just the opposite. You're working to kind of bring some circulation to the spinal column, walk it up and down, roll it up and down. And really, after a couple of times you do it, it's about stomach muscles and balance. You could let go, and you could really stretch yourself out on the ball, up and down, up and down. And for you people who have never done it, the first couple times you get off the ball, don't try and sit up. Come all the way to the ground. Take a minute, get your breath, get up, and go on with your day. But let me show you how this vertebrae looks rolling over the ball, okay? You could see how the vertebrae flex as you're rolling. Those joints get mobility. It really opens up stiffness versus if you're just on the ball and you're pushing those spinous processes down and irritating those nerves and coming up into the vertebrae itself. So that's a tip, that I really like to, I share that with all my patients who tell me that they use these foam rollers. I really highly recommend that you switch over to the ball. Thanks for checking out the YouTube channel. I appreciate it, and have a great day.